name is Fatima Cardoso. I'm the director of the breast unit at the Champalimaud Clinical Center in Lisbon, and I'm also the president of the Advanced Breast Cancer Global Alliance. A diagnosis of advanced or metastatic breast cancer always put a strain on the patient's loved ones. And patients themselves have vocalized that they wish they could provide more support and more help for their loved ones throughout the difficult process. Our discussion today will touch upon ways that we can ensure that caregivers are also looked after and to help them to navigate this challenging time in their loved one's life. So today I am joined for this discussion by Dr. Luzia Travado, a psycho-oncologist from Lisbon, Portugal, Mrs. Linda Alden from the United States, and Sarah Jane Barker from the United Kingdom, both having gone through the role of caregivers, and also by Mrs. Nicole Zernick, a patient advocate from France. And we're going to discuss how can positively support people living with metastatic breast cancer while ensuring that their loved ones are still taking good care of themselves and making their own health and well-being a priority. So before we start, I would ask that each of you tell me a little bit about your background.
I'm Linda Holden. I live in Burlingame, California in the United States. I was a caregiver for my husband, Bob, who was diagnosed with metastatic breast cancer de novo in January 2003, and he lived till February of 2020, 17 years.
Hi, my name is Sarah Jane. I'm based in London, UK, and I was a caregiver to my mum, Angela, for the period of a year, and she was diagnosed in 2017.
Yes, hello everybody. My name is Nicole Zernick, and I am from Paris, France. I have been involved with Europadonna, the European Breast Cancer Coalition, for about 20 years.
Hello everyone, I am Luzia Travado. I'm a clinical health psychologist specialized in psycho-oncology. I have been working for the past 35 years with cancer patients, and I'm very pleased to be working now with Dr. Fatima Cardoso and her team at the breast unit of the Champalimaud Clinical Center at the Champalimaud Foundation in Lisbon, Portugal. I have also the honor to be President Emeritus of the International Psycho-Oncology Society.
So let's start by asking Linda and Sarah Jane to share with us how did you adjust to your loved one diagnosis of advanced or metastatic breast cancer. Do you want to start, Sarah Jane?
So I think diagnosis is an enormous shock. You're not prepared for it. With me, it was, and my mum, it was very quick after she'd been in remission from early breast cancer. And I think everyone dealt with that very differently. I went to my default, which was process. And so I did the planning, contacted her oncologist. I think other members of my family dealt with it very differently, perhaps were more withdrawn, not really willing to kind of accept that it was real. And ultimately we followed my mum's lead. So they were living abroad at that time, and she wanted to return home. She wanted her cat to come home with her. So, you know, we did what she wanted. And, you know, when she wanted to be upset, we were upset. When she wanted to plan, we planned. So I think it's hugely different for everyone. But for me, it was about trying to control some of the steps of the process and help her to really understand what she was about to go through.
When Bob was diagnosed with metastatic breast cancer, he was diagnosed de novo, stage 4. He had gone to the doctor with a lump in his breast a year or two prior, and because he was a male, they didn't biopsy him. So unfortunately, he was diagnosed stage 4. And we were dating about 6 years when he was diagnosed, and he broke up with me because it's terminal. He was given 24 to 30 months to live. He was 41. He wanted me to go on with my own life. So we broke up for about 4 or 5 months, and then we got back together and got married in Hawaii. So, but it was a hard time because he was dealing with his mortality, and 24 to 30 months to be told that is very shocking. So, but then when we got, I always went to every appointment with them and every doctor's appointment, everything from the beginning. So it is a hard adjustment, definitely, though, to be given a terminal diagnosis.
So, Luzia, what would be the best way a caregiver can provide support for someone living with metastatic or advanced breast cancer but still take care of themselves?
Well, Fatima, I think being a caregiver is an act of love. It requires a lot of availability, empathy, a lot of understanding, caring for the other, doing what the other wants. So putting aside your own needs at a certain point and looking after the other persons and hear what she or he wants is quite important, not to impose your own way to the patient, because the patient is already had lose already so much control of their own life that they need to keep control of little things like what do I want to eat today when they are in a more of an advanced stage, for instance. But quite from the beginning, it is very important from the diagnosis on to come to the consultations with the patient so that the caregiver understand what is the diagnosis, what is the treatment, what is the expected side effects, and to learn how to deal with those, what to expect, and how to help.
I also like the idea of the caregiver being part of the team. I think that's very important from the beginning, to include the caregiver in the process.
Yeah, I think my mum was probably most open with me because I was the eldest. I think she saw me as the person that was going to sort of take charge. And I work in healthcare, so I am fortunate enough to have some experience of understanding of the disease, which is not common for many people that will have to be caregivers. But I think it's super difficult because caregivers are given no guidance on how to say the right thing, or when it's fine to just say nothing, which sometimes they just want an ear to talk to.
So I'm going to turn to Nicole, and from the patient advocacy groups and community, what exists already to support the caregivers, and what can be done better? What would you suggest that can be done better to support the caregivers?
It is true that it's a shock to the patient and a shock to the caregivers when the news come. What we can do as advocacy group is help both members of the team. And I would even say that the team is bigger than two people, because there can be more than one caregiver. Caregivers also need support, and sometimes it's the patient who help their caregivers. And we do advise patients to come with their caregivers to their health, to their professional appointments, to their doctor appointments. But to us, they come alone. They come alone because it's a free place. They can talk with their peer. They can talk to the people who have had the same experience. And it's in a neutral place. They can say everything they want to say without being judged, and that is important. So we do tell them to be as many people as possible in a team and work together in the team.
And Sarah Jane and Linda, did you find comfort and help in any support group of your peers, of other caregivers?
It was very difficult, I find, to find a support group. And that's one thing with Zoom now. I'm hoping that support for caregivers can become easier, because caregivers can't always leave their home to attend a support group. Because support is definitely very important. I think when I needed support, I would reach out for therapy, or because mental health, of course, is definitely a priority. So, because I didn't find caregiver support groups to be supportive enough because not enough people participated.
Yes, the same there. I didn't find any caregiver support groups. I also have a younger sister who was in her early 20s and who wanted to connect, to be able to connect with other people that were experiencing this, well, it's not a journey, it's it's a long, shocking roller coaster, and she wasn't able to have that either. So for me, having someone as a therapist was really actually critical for me, so that you had space every week to go, and although they weren't relating to you because they were going through the same experience, they were an ear to listen, and you weren't leaving that burden on other members of your family or your friends, and it was impartial. So I think taking that space as a caregiver to have a therapy or a psychosocial support is really important.
Thank you for sharing that. And Luzia, what would you suggest as coping mechanisms for both the patient and the caregiver of this, let's say, interference of how will the side effects impact on the caregiver that sometimes takes a leading role in the treatment decision?
I think that it is quite important, as I mentioned from the beginning, to have the caregiver with the patient, and even when they don't come, ask the patient, bring your loved one, the person who is most important to you, to the consultation, so that we can know this person. There are not many resources in terms of psychological support for caregivers. They are scarce even for patients. So we have to do better in that regard, because it also prevents a lot of depression and then complicated grief, which impacts on many diverse activities and also at the economical level.
I will let now each of you to say other practical tips that we can give to those that are listening to us.
I would like to come back to what Luzia was saying, and how important it is that caregivers come with the patient to the consultation. 4 ears hear better than 2. 4 ears don't always hear the same things. And this way, when they go back home, they can still talk about it and confront what they heard.
So I think you spend a lot of time focusing on the patient and the disease and the treatment, and that's very draining, and I think it can be really easy to forget to care for yourself. During this period, I spent a lot of time trying to find ways to be kind of well, and take time for myself and almost be in the moment. I think it can be easy to focus a lot of your energy on the end and what will happen, but I think being well and basics of just sleeping, eating well, and taking some time away where you have time for yourself to be emotional or be angry or be whatever you want to be in that time are really important, because you can't support that patient if you're not well in yourself.
I've always liked the analogy that you need to put the oxygen mask on yourself before you can help somebody else, and because I think it is so important that the caregiver takes care of themselves.
So from your experience as a caregiver, what were the resources that you wish you had access to?
I wish that there was a resource of caregiving classes so that they could hopefully teach you how to be a better caregiver, what you need to know when you're going to appointments with your person, and how to take care of yourself from exercise, sleep, nutrition, mental health.
Mental health and being able to recognize how a patient is when you spend all that time with them and looking for signs and symptoms. There are things now like mental health first aid, but what does that look like when you're caring for someone with a metastatic diagnosis? I think tools to help you help the patient or the person would be fantastic. And in addition, I think specific information about what the treatment pathway will look like. I think that differs very much between types of metastases. If you're not prepared to see your loved one going through some of these things, it can be even more of a shock. So I think some tailored information so that you know exactly what treatment will look like and what it means and what they can and can't do following that, so that you can almost help to plan around it as well.
Thank you. I would like to thank all of you for participating in this discussion, and especially to Linda and Sarah Jane for sharing with us your personal experience.